Doctors have read it. What's something someone came to the hospital for that they thought wasn't a big deal but turned out to be much worse? I'm an ER nurse. I cared for a patient that came in because she woke up with a severe headache and a knot on her head. She went to CT for a head scan and had 2 bullets in her head. One had gone in at the top of her head just past her hairline and traveled under the skin, but on top of her skull to the back of her head. The other went straight in, but just fractured the skull behind her ear, didn't go all the way through the skull. They were smaller caliber bullets. Apparently, she went to sleep the night before after taking an Ambien, and there was a drive-by shooting on her street. The bullets went through her window, and she slept right through it. She woke up instantly after being shot and headed straight to the ER, unaware that she got shot due to shock. Don't interpret it as she waited 6 hours after being shot, then went to ER. That's impossible. Note to self: never take Ambien, you will go into a fucking coma. Ambien also causes some people to sleepwalk and sleep eat. Much like the time I took my Ambien and my wife found me standing at the refrigerator butt-ass naked at 3 a.m. eating slices of cheese one by one. I no longer take Ambien. Can relate. Stopped taking it after I woke up eating a loaded baked potato I didn't remember making. The scariest part? I'd crunched up more Ambien and sprinkled it on the potato. Oh, and then there's the sexsomnia. Yes, that's a real thing. And it's a lot less funny when you have to have that conversation with your ex. When I was doing my hospital placements, a patient came in laughing and skipping for their scan. They thought 100% they were in remission and clear of cancer growth. I was spending a day with the skin techs and sat in. The skin didn't show one tumor. It showed hundreds. The guy was riddled with metastases. It was terminal. He had months. He was laughing and smiling with us. He asked if we could tell him how it went, and the tech said we couldn't, it was for the doctor. The old man winked at us and walked out. He was so happy. It was one of the days that told me I couldn't do that job. How old was the patient, and what are you doing now? He was old, though not that old, 60s, I think. I decided practice wasn't for me, so when I finished my degree I became a journalist instead. I now work as an editor on a medical journal. Had a guy come in complaining of a cough and difficulty swallowing. He thought he had tonsillitis and just wanted some antibiotics. I noticed his voice was incredibly hoarse, but there were no swollen tonsils, so sent him for a chest x-ray. Huge, baseball-sized tumors all throughout his lungs. One of them was pressing on the recurrent laryngeal nerve, causing his speaking and swallowing problems. He died within a week. Why am I reading these? My God, am I gonna make it through today? I guess no one has told you the news yet. My best friend's sister went to the hospital for what she thought was a lingering flu. She walked out with a diagnosis of bowel, stomach, and liver cancer and died 9 months later. A coworker of mine was hit by the boss car. Turned out she had rabies, practically saved her life. A year or 2 ago here in Texas, a woman went to her optometrist for a regular exam. She later told the news after a long silence. He asks, "Did you drive here?" "No." "The person who drove you here needs to drive you to a hospital immediately." "Why?" "Because you're about to have a stroke." Yes, strokes are scary. My mom had one in the airport, and she was being annoying and kind of sounding drunk. I had no idea what was wrong with her. Then she got on a plane. Then when she landed, went to hospital. She got on another plane to visit me after she had another one and didn't even want to go to the hospital. She just was like, "Oh, it was a little something." "No, Mom. Stroke." Don't have much time, so I will keep this short. Patient presented with a small, less than 1 inch, scratch on his right thigh and severe pain and immobility. On palpation there was crepitus, a cracking sound. We called in a surgeon in the hopes that we could excise the closed wound, but as soon as the surgeon cut the skin the leg deflated. Yes, deflated. The escaped air was horribly putrid in odor. We ordered an X-ray and discovered the leg was simply skin and bones without any signs of muscle. I regretfully informed the patient that we had a strong suspicion of a flesh-eating bacteria called Clostridium perfringens, and that the infection was spreading fast. He called his family and loved ones, got a lawyer, and said his goodbyes. 12 hours after admission he was declared dead. Where is this bacteria commonly located? Soil. Plants that grow in soil. Fruit that grow on plants that grow in soil. Animals that eat plants or fruit that grow in soil. Meat that came from animals that eat plants or fruit that grow in soil. I hate you. Not a doctor, but I was in a fender bender car accident. I was at fault, and my lower back would not stop aching. I went into the ER figuring I had sprained the muscles in my back and that I would be prescribed muscle relaxers and maybe some pain pills. 6 hours, several x-rays, a CAT scan, and 4 doctors later, I found out my spine was broken and, get this, healed. The best theory any of them could come up with was that my spine had broken during birth, and since we never knew, it just healed itself, filling in with cartilage. One of the docs told me that had we known my spine broke at birth, I would have likely never walked and would have been treated as handicapped my whole life. I didn't find out until I was 20 and already had a child. My mom cried because she always thought I was just a really colicky baby, when in fact I was probably in a lot of pain. December 7, 2012. We brought my father-in-law to the ER because he just wasn't acting right, mixing words, feeling tired. My husband and I thought for sure he had a mild stroke. The ER staff thought he had a stroke too, because of his symptoms, and he was 79. They did a scan and nope, cancer. 3 huge tumors in his brain. We took him for more tests the next day, and it was lung cancer. A tiny spot in his lung that traveled to his brain. He died 13 days later, on my husband's birthday. How is your husband doing? It's still hard. We live in the same little town that he did, where my husband grew up. His birthday has become such a sad, sad time. Plus, being so close to Christmas, it's just taken the joy out of it all. It especially hit our daughter quite hard, with whom Grandpa was very close. Not a doctor, but a couple of years ago my mother had a lump in her breast, so she went to get it checked out for breast cancer. Her mom died of breast cancer, and her sister has had it twice and has had her breast tissue removed. Fortunately, however, it was just a cyst. But wait, there's more. Turns out hiding behind that cyst was some early-stage cancer. Was easy to get rid of, and she's fine now. I thought I had a nasty flu strain. Was feeling generally like crap. Didn't go to hospital until 2 days later. Was in operating room less than an hour after that. Appendicitis. Appendicitis is evil. I thought I had food poisoning. Then they emergency took out my appendix at 1 a.m. Appendicitis. I had it when I was 16 and it was a similar situation. Woke up, didn't feel good, went to hospital and rushed into surgery. Since there was time pressure, the doctors and nurses were kind of all over the place and were forgetting things. They gave me a very strong painkiller right before they put me under, which made me loopy as fuck. About a minute after they gave me the painkiller, on the way into the operation room, one of the nurses goes, "Wait, we have to give her a pregnancy test." I turned to her, looked her straight in the eyes and said, "If there's a baby in there, you can cut that out too." Needless to say, I didn't ever take that pregnancy test. Not a doctor, sorry, I'm gonna be that guy. After I got my appendix out, I went back a week later thinking I was constipated. Nope, I had a giant-ass abscess that had started to wall itself off. They went in to drain it, and I woke up in ICU 5 days later recovering from sepsis, septic shock, and kidney failure. Not a doctor, I'm an EMT, but when I was deployed to Afghanistan as a medic, a medevac pilot came in because he had a small abnormality on his flight physical EKG. Apparently this was something he had been getting waivers for years for. I had just finished an ANP class and learned about something called Brugada syndrome, which is basically an arrhythmia that causes sudden cardiac death in the patient. I jokingly mentioned how his EKG reminded me of the abnormality I saw in my textbook, thinking there was no way he actually had it, and it had to be artifact from the EKG. The doctor's eyes widened and he sprinted out of the office. The pilot had it, was immediately relieved of flight duty, sent home, and had a defibrillator put into his heart before being medically retired. My sister-in-law thought she had a cyst on her shoulder. Nope. Round cell sarcoma. The doctor said she had 2 months. She lived for 8. Was it cyst painful, do you know? I don't know. I do know it was getting abnormally large. She got them fairly often, as does most of my family. My cysts tend to be painless most of the time, though one gets inflamed once in a while. She went to the GP to get it lanced, as it was big enough to cause problems. The doc made a tiny cut, then put a bandage on it and said something to the effect of, "You need to go to oncology now." When I was 12, I had a crazy bad headache that wouldn't go away. My dad brought me to the doc, and I didn't even make it to the exam room before they turned me back and sent us to the hospital. It turns out my headache was from a burst sinus cavity, as in all the bones around my eye broke and the liquid leaked back onto my brain, giving me brain meningitis. My eye was bulging out to the point where I looked like an alien, and they told my parents I was not going to make it. Obviously, I pulled through but was hospitalized for 2 weeks and missed 2 months of school. I was at the time only the third known case of this happening, and they had flown in doctors from all over the US and from the UK. Crazy stuff. I thought it was just the worst headache. Turned out to be so much more. Not a doctor, but my ER doctor told me if I had waited 12 more hours I probably would have died. So I was taking antibiotics for dental work that had been done, and noticed these weird blisters showing up everywhere. Weird, but whatever. 48 hours later, they started opening up, leaving holes in my skin, no blood, just lost most of the skin in that area. Again, weird, but I was working, so whatever. Then they started appearing in my throat, so I got to the hospital ASAP and was diagnosed immediately with Stevens-Johnson syndrome. Any longer and the layers of my skin would have literally peeled away from each other, and I would have died. That was a sobering day. Do you have a similar story? Leave a comment and subscribe to the channel if you want to see more videos like this one.